I'm Dr. Jess Mason, and this video is going to show you placement of an EZ-IO in a real patient, in a real code, in a real hospital. But first, before you get too drill happy, let's go over what's in the kit so you know what to expect. It comes with a drill. Without it, it wouldn't be so easy, would it? It comes with 3 needles. We've only got 2 today because we're on a budget. There's pink for pediatric because all kids like pink. Blue, which is not shown, fits in most adult sites, and then yellow, which works well for the adult humerus and areas of adipose. So you can remember yellow, adipose, you're welcome, enjoy your dinner. It attaches magnetically to the drill, and then once it's drilled into place, you're going to remove that stylet. Safety first. And then this proprietary dressing fits nicely over the top right there, and you can then connect your tubing. And you're all ready to go. For the proximal tibia, you want to feel 2 finger breadths below the tibial tuberosity, and you're going to go on that anteromedial surface. So you're going to prep the skin, of course, first. Now with your drill, here they're using the yellow one. The blue would also work. Yellow might be a little long, so you just don't want to hub it. You're going to advance it through the skin and then drill until you feel give. That's how you know you're in the medullary cavity. Don't push it beyond that because you don't want to go through the medullary cavity. Now you remove the stylet, and you can place that fancy, beautiful dressing. And now you can hook up your tubing. So they're going to draw off some labs here, which is great for things like H&H and type and screen, but some of your elements of your chemistry panel are going to be very different from your serum levels, so you want to be careful. And remember, you can give any medication through an IO line. For infants and kids less than 6 years old, the proximal tibia is actually the preferred site. Here's some other options for placement. You can go in the distal tibia as well, and basically it's like the medial ankle, where the medial malleolus meets the shaft of the tibia. Another option is the distal femur, and for that you would go 2 finger breadths above those wide condyles of the knee, and that's right smack in the middle. And finally, there's the humeral head, and you're going to go in the greater tuberosity of the humerus. Now, if you're going to do this in an awake patient, then I recommend using some anesthesia, and you can use my mnemonic 2 of 2 for 2 times 2. That's 2 cc's of 2% lidocaine over 2 minutes, then do a flush and wait, and then repeat it, so times 2. 2 of 2 for 2 times 2. And that gives your patient 80 milligrams of lidocaine. Some people use a little more, a little less, but that's a safe amount. I also recommend anesthetizing the skin and periosteum before you start.